So yes, even though it is a normal process, it doesn't mean we just have to let it run its course. Even though menopause is a natural process in a transition, there are still 85% of women who have pretty significant symptoms during that transition that can affect a lot of parts of their health. And that's kind of why we do probably need medication or supplements or something to help us, because the goal is to be optimal. Menopause is different than aging, but menopause and aging, sometimes their symptoms overlap. Menopause does affect a woman's health and how she ages, and there are some specific things that we really should care about. So is hair loss and erectile dysfunction, but we still treat that too. So menopause does affect a woman's quality of life, specifically the vasomotor. That stuff, it really gets women. It affects so many pieces. So yes, they could suffer, but they don't have to anymore. Historically, in the past, women have not spoke up against maybe their healthcare provider because they were intimidated or that they were worried that they would get cancer if they had treatment for their perimenopause or menopause symptoms. Also, women's health is behind, so it's not like people actually researched or cared about menopause symptoms. Women generally just suffered in silence. I witness this firsthand because I'm a women's health physical therapist. There are some women that have had symptoms that I am helping them treat, and they have suffered for 20 years. 20 years. Could you imagine? I can't. So with the age of technology and information, an informed consumer, this is why I think you see that people are caring about treating the transition between perimenopause, menopause, and that's why you see this. Now, in my own personal commentary, it's not like we live in an exceptionally healthy world compared to 50 and 100 years ago, but humans are living longer. And as women age, we are transitioning into perimenopause and menopause later than in previous decades and generations. So for more than 25 years, the NIH has used SWAN, which is the study of women's health across the nation, and they have generated groundbreaking research. And so SWAN is investigating all the things that women are talking about with menopause. But this includes physical, biological, psychological, and social changes that occur in women. The longitudinal nature of SWAN has enabled it to distinguish some of the effects of midlife aging versus changes in health due to the menopausal transition. In essence, the effects of chronological aging versus those of ovarian aging. Okay, so this is from Dr. Dutta with the National Institute of Aging. This is something that actually isn't talked about enough, but this is where I think some people think that menopause is just, it's just part of aging. It is, but it isn't. Stay tuned for more. Hit the plus sign.